What determines the cost of comprehensive genetic testing? Imagine trying to read a giant instruction manual for building a complex machine. The more pages and details you need to understand, the longer and more expensive it gets. That's similar to how genetic testing works. The cost depends on how much of the genetic blueprint you want to examine. First, the scope of the test plays a big role. If you're only checking a few specific genes, like those linked to a certain health condition, it costs less, usually between $50 to a few $100s. But if you want to look at your entire genome, which is all your genetic material, or your exome, which is just the parts that code for proteins, the price jumps significantly. Whole genome sequencing can cost from $500 to several $1,000s because it involves analyzing billions of DNA building blocks. Next, the technology used impacts the price. Advanced sequencing machines and detailed data analysis requiring more sophisticated equipment and software. Tests that look for rare or complicated genetic changes need special methods, which add to the overall cost. Laboratory standards also matter. Labs that are certified by recognized organizations follow strict quality rules, and this often means higher costs. These standards help ensure the results are accurate and reliable. Turnaround time is another factor. If you need results quickly for urgent medical decisions, labs may charge extra for expedited processing. This can mean getting your results in a few days instead of weeks. The reason for testing influences the cost too. Medical tests ordered by doctors for diagnosis or family planning often include professional consultations with genetic counselors or doctors. These services help interpret the results and guide next steps, adding to the total expense. Insurance coverage can make a difference. Some health insurance plans cover part or all of medically necessary tests, which lowers what you pay out of pocket. But direct-to-consumer tests, which you buy online without a doctor's order, usually aren't covered and must be paid fully by you. Testing multiple family members can increase costs, but some providers offer discounts or bundled prices if relatives are tested together, especially if a specific genetic change has already been found in the family. Understanding these factors helps families plan better when considering genetic testing. Talking with a genetic counselor or healthcare provider can clarify which tests are best for your needs, what they cost, and what your insurance might cover. This way, you can make confident choices that fit your health goals and budget.